Japan, the land of rising sun, tall buildings, modern infrastructure, humble people, and cherry blossoms, is the second strongest economy of the world. Japan's participation in the Colombo Plan in 1954 marked the beginning of Japan's official development assistance to the international community. In 1964, with its entry into the Organization for Economic Development, Japan joined the ranks of the developed nations, thus expanding its economic cooperation to the developing world. In 1989, Japan emerged as the largest ODA donor, which, with the exception of 1990, it continues to be. Japan's ODA Charter, adopted after the Japanese Cabinet's resolution in 1992, lays down its basic principles. The primary tenets guiding Japan's ODA philosophy are humanitarian considerations, recognition of independence among nations of the international community, environmental conservation, support for the self-help efforts of recipient countries. The three-pillar system of Japan's official development assistance ODA consists of bilateral loans, bilateral grant, and contribution to multilateral institutions. The Japan International Cooperation Agency and Japan Bank for International Cooperation are official agencies with statutory mandates to provide technical cooperation and soft loan. Japan has been a development partner to Pakistan for over 50 years, supporting and assisting the government of Pakistan in the vital areas of health, education, agriculture, infrastructure and communications.
Japan is the largest development partner of Pakistan. Their contribution in the stock of assistance over the years has been of the order of about 20% in terms of ODA programs. It has a huge impact in terms of addressing the poverty issues, in addressing the health issues, in addressing the skill deficit that we wish to address through our government policy. So that's the kind of support which is critical in upgrading the skill levels across both public sector as well as the private sector. It is important intervention to support the government's poverty alleviation programs. It is a great help in addressing the health sector and education policies of the government.
The Japanese cooperation has been instrumental in improving the social sector, human resource development, as well as reducing poverty in Pakistan in 1990s. In its endeavor to establish a sustainable society in Pakistan, Japan proposes human, regional and economic development as three vital areas for future cooperation. Japan International Cooperation Agency, JICA, an official agency with statutory mandates to provide technical cooperation, became an administrative institution in October 2003.
JICA itself has around 1,200 personnel, and the budget is around 80 billion rupees. And we have overseas offices in more than 80 developing countries. So far, around 5,000 experts or volunteers, they're all Japanese, they are staying in these developing countries to tackle with, together with their counterpart, for the social and economic development.
Children are the future of a nation. A ray of hope, the promise of a better tomorrow. Pakistan is one of the 6 countries where this hope is still stolen by polio. Government of Japan has been helping the government of Pakistan since 1996 in its campaign for eradication of polio. It has so far provided a total of $58.7 million for polio vaccines.
Government of Japan has been our single largest bilateral partner and donor to this program. And our support from the government of Japan goes back to 1997, specifically for polio. So I think the contribution of the government of Japan has been very instrumental in meeting almost anywhere between 40 to 50% of our vaccine requirements per year. So it's a tremendous contribution, and of course we're very grateful for it.
The Japanese government dispatched JICA experts, 2 long-term experts, including me, and 16 short-term experts have been submitted already for technical support for polio eradication in Pakistan. During polio campaign, I visited districts and villages to monitor mobile teams and health facilities. I visited Shangri-La, Swat, and Bunel many times. The people in this area are living in mountain areas, so I needed to climb mountains for several hours to monitor these areas.
Pakistan, ranking 6th among the 22 high-burden tuberculosis countries worldwide, accounts for 43% of the TB disease burden in the WHO Eastern Mediterranean region. In a society where on an average a family of 5 depends entirely on the earnings of one economically productive adult, most of the 270,000 people contracting TB every year are such adults. JICA is collaborating with the Government of Pakistan in establishing a quality implementation structure for DOTS in 4 districts of Punjab to reduce TB-related deaths and contain its further spread.
In Pakistan, there is a TB control program based on the TB DOTS strategy that is recommended by the WHO. And then once we give the training to the doctors, paramedics, and lady health workers, they will work as a force for eradication of the tuberculosis. They detect the TB patient, and then they treat the TB patient very effectively. So once we give the training to all categories of the medical staff, they will work very well in the program of the TB DOTS of Pakistan.
Without training the whole cadre, you cannot implement DOTS. This is the first component. So JICA is not helping only in training, in whole DOTS package. And of course, training is one of the components where JICA is helping us. So I would say that with very good quality of training, DOTS starts.
Out of the 5.5 million babies born annually in Pakistan, nearly 270,000 die before they are a month old. The percentage is roughly 10 times higher than in the developed countries. According to a report by the National Institute of Child Health, Nearly 60% of these deaths occur during the first few days after birth, and a vast majority of them are preventable through available and cost-effective means.
And the major barrier is the lack of the skilled staff in the scaling up of the newborn care in the country. JICA has done a commendable job in starting this in-country training program on the safe management of newborn infants. Under this program, the pediatricians from all the 4 provinces of Pakistan, they are selected on a yearly basis, and they come here in Islamabad at the Pakistan Institute of Medical Sciences, the neonatology department, and they undergo training for a period of about 5 weeks. And then they go back and work in their respective hospitals and establish the neonatal units there. There will be some dent or impact in the newborn health, or especially the reduction of neonatal mortality at the end of this program.
The Pakistan Education and School Atlas, published recently, has worked out male literacy at 60% and female at 36%. Thanks to the toiling of various stakeholders, there has been a sharp increase in literate or educated women in Pakistan. The literacy rate rising from 16% in 1980 to 21% in 1990 and jumping to 33% in 1997.
This is Project Swing, which is conducting various educational activities throughout Pakistan. Of these, I have been providing technical assistance to the Adult Literacy Project and Non-Formal Basic Education Project. Many donors are, for example, working on the teacher training for primary school, and I'm also trying to improve the quality of education for non-formal basic education schools.
The Punjab Literacy Promotion Project, supported by JICA, is working in the 4 model districts of Punjab.
DJ Khan है, वो खानेवाल है, कुशाब है और मंदी बहावती है. इसमें 2 phases हैं और फर्स्ट फेज जो है इसमें डेटा कलेक्शन और डेटाबेस इसको बनाएंगे. फिर इसके ऊपर प्लान करेंगे. वो फेज 2 में जो आएंगे सेंटर और स्कूल्स इसको खोलेंगे. इस डेटाबेस के तहत वो प्लान करके बनाएंगे.
The project has been designed to benefit about 1 million people directly, providing primary education to more than 300,000 out-of-school children, besides establishing 16,000 adult literacy centers.
With JICA, we conceived the project. We have collected the names of the illiterate. We have collected the names of the children. We have collected the names of the dropped out and left out. We have gone to each and every house. And when you have these people with you, then you are going to launch an awareness campaign, a motivational campaign, the community participation, the response from the community. That entire thing is going to matter for us. It's a huge challenge, and I'm fully sure that we have planned it well, and hopefully with good planning parameters, we inshallah will be achieving that.
In addition, the government of Japan has helped establish 30 schools equipped with audiovisual teaching aids in the 10 districts of Northwest Frontier Province. In the 2003, JICA supported and funded training of head teachers and subject teachers of these schools in school management and use of teaching aids.
यहाँ पर हमें ये समझाया गया कि ये आपने किस तरह पढ़ाना है और बुक्स के साथ इसको किस तरह रिलेटेड करना है और किस तरह बच्चों को समझाना है. उसी के थ्रू हमने बच्चों को फिर से पढ़ाना शुरू कर दिया और उसी इक्विपमेंट्स को यूज़ किया जो कि हमें जापान ने प्रोवाइड किए हैं, जिसकी बदौलत अब हमारे लिए ये पढ़ाना बिल्कुल इतना आसान हो गया है कि हम बच्चों को पहले रटवाते थे, स्टिक से करते थे, कुया और हरबा इस्तेमाल करते थे, लेकिन वो बहुत मुश्किल था. लेकिन अब हम गेम में अब बच्चों को समझाते हैं और वही औजार इस्तेमाल करते हैं जो कि इक्विपमेंट्स हमें मिले हैं स्कूल में.
The Japanese Overseas Cooperative Volunteers, JOCVs, are young people extensively trained by JICA, who volunteer generally for a period of 2 years to assist and facilitate the social and economic development of developing countries. The JOCVs are actively engaged in effective transfer of technical expertise in the developing countries. While sharing the Japanese experience of expanding technical education and skills training at the secondary level, they are also busy strengthening the bond between the two countries. Ms. Sivane is one such volunteer who has come all the way from Japan to live in Pakistan and work with the TB patients at TB Center in Rawalpindi. Speaking their language, wearing their clothes, her expertise and dedication, coupled with her smile, is warming up the patients' hearts, filling up an otherwise gloomy place with sunshine. A sunshine she brought with her all the way from her hometown in Japan.
मरीज हमेशा हमारे रूम आते हैं तो अच्छा लेक्चर दिया तो अच्छा मोटिवेट करवाया तो हमेशा मरीज भी शुक्रिया या मेहरबानी वो कहते हैं और हंसी भी आते हैं तो मुझे भी बहुत ये हंसी देखा तो बहुत खुशी हो जाएगी.
This is the contact of people with people, surpassing the barriers of language and distance, binding them together. This is the ultimate dream of a borderless society. Side by side with these JOCVs is the dedicated contingent of senior volunteers. 40 to 69 years of age, senior volunteers are the experts with extensive skills and plentiful professional experience, most of whom have played an active part in the rapid economic growth of the post-war Japan. Currently, 16 such volunteers are working in Pakistan, directly contributing to the development of human resources and thereby assisting the national development.
I hope that my contribution will do well at the higher educational level in Pakistan. Furthermore, I hope to contribute my experience here in Pakistan for the development of Japan.
At Samida, senior volunteers from Japan are sharing their skills and experience with local textile enterprises to help improve the quality and increase the production.
They go observe the operations and then suggest measures for improvement and productivity. Optimal capacity utilization. Introducing new and more efficient management techniques. They sit down with the senior management, work it out, how are they operating, how they manage the whole operations, and then work out. Cost controls. There have been incidents where the Japanese senior volunteers, after spending some time with the factories, found out that the operations were resulting in high levels of wastages. So cost control is one of their benchmarking with the international textile countries where textile industry is advanced. So all of this is a package that these Japanese senior volunteers provide to the factory owners.
For the people commuting between Cohort and Peshawar on the rough mountainous track, the Cohort Tunnel is more than the proverbial tunnel. They see light at the beginning of it. Built with Japan's assistance, this first modern and longest roadway tunnel in Pakistan has connected the thus far underdeveloped, underprivileged regions of NWFP with the rest of Pakistan, thus unfolding a vista of limitless opportunities for the people living there.
टनल की वजह से ये सहूलत मिल गया कि गाड़ी भी नहीं कालची होता है, हमारा डीजल का भी खर्चा कम होता है, दूसरा बात ये है कि खतरे से गाड़ी निकल गया.
In another part of the country, government of Japan gave way to life. A water treatment plant was constructed with the help of a soft loan from Japan Bank for International Cooperation under the Metropolitan Water Supply Project to supply drinking water to the twin cities of Islamabad and Rawalpindi. Today, it provides clean drinking water to millions of people. Alongside building roads, JICA, in collaboration with National Highway Authority, has arranged environmental awareness seminars ranging from social environment and noise pollution for the national highway environment.
I brought here the report from 2 seminars. I will, after the seminar, I will send this report to participants of seminar and many stakeholders. This is very new issues for here. And when we conduct the seminar, we selected the issue, what demand here, and how the direction I have to bring this Pakistan, this sector.
The friendship between Japan and Pakistan is a step on the long road to a peaceful and prosperous world. An amity centered on building a national identity based on dignity and pride and ensuring the sustainability of development. An amity that has helped reduce the distance between dream and reality, that has reached out and touched the hearts.
My message for the Pakistani people that we, Japan or JICA, has extended a lot of cooperation for Pakistani people. But we know very well, and of course, Pakistani people will understand that the development activities, it's of course activities of Pakistan people, not only the ministries or provincial ministries, but people themselves. So we try to make a very good collaboration with the Pakistani people, always paying great respect for their initiative and their ownership, so that to secure the sustainability of all the development activities. I wish our cooperation will lead the betterment of the people in Pakistan.